Greetings, I'm Dr. Max Gomez at the 5th International Vatican Conference, and I am joined now by a good friend, Dr. David Pearce from Sanford Health. Welcome, David. How are you?
I'm good, Max. Great to be here again.
Thank you. Thank you. So let's talk a little bit about the Sanford World Clinic. Tell me a little bit about that. What's the theory, if you will, of being able to get at children who need health care this way?
Yeah, I mean, the genesis of this idea, was rooted several years ago, knowing that there's going to be global health at some point, and that we can learn from different communities around the world in terms of how they deliver healthcare, how they pay for healthcare, and also, learn about the different maladies that exist, out there. So that was the idea: is if if we're welcomed into certain communities around the world, we can assist and learn and do some good.
So the philosophy here is if we have something that we can offer the kids to bring them in, we can use that as a touch point to then deliver other important healthcare.
Yeah, that's a great way of looking at it. As the program has evolved, I mean, we started in pediatrics, and then of course many countries have primary care where it's all takers. But what we felt is that absolutely, attribution is a really powerful type of word that you use in healthcare. So if you actually bring in someone for one type of treatment or education, or in the case that we're going to be talking about in a minute, providing them shoes, then you can deliver healthcare, you can deliver other, very valuable, insights, but also medications to children.
So let's talk about that. It's in Ghana is sort of the pilot program now. How do shoes fit into healthcare?
Yeah, well, we have a wonderful partnership with a wonderful human being called Manny Ohomi, who has an organization called Samaritan's Feet. I mean, he grew up in Nigeria and won his first pair of shoes, in a basketball contest, went on to play basketball here in the United States at college, but never forgot his roots, knowing that, in many countries of the world, kids just don't have shoes. So he's developed a shoe. It's much like a Croc that has an antimicrobial agent embedded in that shoe. So the kids running around in these shoes, should be less susceptible to footborne diseases and parasites and all sorts of things like that. So with Manny, I basically said, this is fantastic, but I also see this as an attribution strategy. Why don't we give the kids the shoes and then give them either a vaccine or some sort of other medication? My and our Sanford's utopian goal is this is a vehicle to deliver vaccines across the world in developing nations. So our first pilot is in Ghana. It's a relatively sophisticated country and doesn't need vaccine distribution just yet. But they said that there's a great need for giving the kids the worm pills because that's a parasite or parasites that affect them. So in May, we're going to be taking 1,000 pairs of shoes, 3 schools in the Accra area, giving those shoes out with Manny, and then we're going to give these worm pills. We're going to measure the success of the program when we go back in November, when we give them the second dose of the pills, and we're planning to take 10,000 pairs of shoes for that, because we're optimistic this is going to be a successful strategy.
That's fabulous. So how do you expand? Where do you scale this up? How does that happen?
Well, we have to go where we're welcome. So we're prospecting a number of other countries now in terms of, hey, we've got this idea that maybe we can help distribute vaccines. So it'll take some work in identifying, but obviously in sub-Saharan Africa, I suspect there'll be a number of countries. And then also in South America as well, we've started to have some discussions.
Worm pills, vaccines, anything else that you think is sort of a target of opportunity?
Well, that will be our learning. I think, the different communities in different countries, I'm sure, are going to come back and say, hey, this is something that we would like to deliver. And obviously, if it's going to assist the kids, the communities, we'll be all in and learning. So I would hope by the next time, we speak at this conference, we'll have some real positive stories and data to share on the success of this program.
And Dr. David Pearce, I really look forward to that. This is such an important initiative. Thank you for all the work you and Sanford Health do. We appreciate it.
Thank you so much, Max. Always a pleasure.
Likewise.